great that we can come together this way to mark and observe what I think are some really historical things that the House and Senate were able to accomplish. Working together in a bipartisan way in the Senate, we were able to reach agreement on what I think is just an amazing piece of consumer-friendly legislation, legislation that goes a long way, I would say, perhaps farther than any other place in the country, to make insulin in particular more affordable, to create drug affordability, to provide for EpiPens, to do a number of things, and particularly in our current health climate, that is just so, so important for the residents of New Hampshire. So I'm really excited about the legislation, and I'm looking forward. I've got my pen ready to sign, but I want to hear from a few of you as well. So Senator Sherman, will you?
Yes. Thank you, Madam President. You know, as a physician and also as chair of Senate Health and Human Services, I've always remarked that one of the fundamental aspects of healthcare that differentiates it from other markets is that human lives and our wellness actually depend on it, underscoring the imperative that it must be accessible and affordable. There is virtually no component of healthcare where this is more critical than life-saving drugs like insulin and epinephrine. This necessary dependence on pharmaceuticals could translate into a very lucrative business venture at the expense, both literally and figuratively, of patients and taxpayers. This landmark omnibus bill provides mechanisms for monitoring of the costs, protections for vulnerable patients in order to assure access to needed drugs, and strikes a practical balance between the affordability and the ability of manufacturers to cover costs and make a reasonable profit. Introduced by Senate Democrats, the need for this legislation has been underscored by its support on both sides of the aisle, as well as with the stakeholders who are here with us today. And I can't tell any of you enough how much I appreciate the work that everyone has done in making this possible. Thank you, Madam President.
Thank you, Senator Sherman. Senator Feltes?
Thank you, Madam President. Thank you, Mr. Chairman. And thank you both for your leadership on this. This bill captures so much work that we've done on healthcare costs and prescription drug affordability for consumers. It captures transparency efforts led by Senator Sherman. It captures consumer protection led by Senator Fuller Clark. It includes reverse auction led by Senator Rosenwald, EpiPen coverage led by Representative Grassi, an importation program of safe, low-cost, reliable prescription drugs from Canada, a bill I filed and so many on this call led on, and of course, insulin affordability, a bill that Representative Muscatel filed and myself and others worked on. And so a lot of thanks go out to all of those sponsors, but in particular, this wouldn't have gotten done without the leadership of the Senate President, Donna Soucy. She really led this effort to get this to the finish line. And I'm grateful for everything she did. I'm grateful for the work of everybody on this call, including the chairman of HHS, Tom Sherman, the chairman of Senate Commerce, Kevin Kavanaugh, and it's going to make real world impacts. We have the highest healthcare costs in the nation, right here in New Hampshire. The prescription drug affordability is one of the principal drivers of why so many people to this day in New Hampshire ration life-sustaining prescription drugs because they can't afford it. And all too often it leads into terrible situations, including trips to the emergency room, which is not right, not fair, and ends up increasing costs on everybody else. That's part of the reason we have the highest healthcare costs in the nation. This will help us get a handle on that. And especially now when so many people across New Hampshire have been economically devastated by COVID-19. This is coming at the right time. It's relief that's needed for people on the ground. And for the 130,000 folks in particular that live with diabetes, a $30 per month prescription price cap, the most progressive price cap in the nation, is going to keep them with the insulin that they need. And that's going to make a huge difference. And this bill, Madam President, folks on the call, literally will save lives, and it will reduce costs for everybody. So I'm honored to be part of the crew here and part of the effort to get this done. I'm hopeful Governor Sununu will sign it into law. And I want to also thank all of the advocates and activists and people who testified at the hearings, raised their voice about how important this is. And with that, I would like to turn it over to one of the advocates who helped lead on this, Holly Stevens from New Futures. Are you on the horn?
Yes. Madam President and Senators and Representative, I want to start off by thanking the Senate sponsors of the individual bills that were combined to form what is now House Bill 1280. I would also like to thank all 24 senators for their support of this critical prescription drug legislation. While we know access to affordable drugs is always critical, the past few months have heightened the need for House Bill 1280. And it's extremely pertinent in the time of COVID-19, as people with underlying medical conditions are 6 times more likely to be hospitalized and 12 times more likely to die if they contract COVID-19. And this includes people with heart disease, lung disease, and diabetes. Even with health insurance, many cannot afford their needed medications and are forced to ration and skip doses, as Senator Feltus referenced. This is especially troubling when the CDC has stressed the importance of people with underlying medical conditions taking all medications as prescribed to minimize the risk of complications during this time of this pandemic. Additionally, according to the American Diabetes Association, about 1 in 10 Granite Staters have diabetes, which is the 130,000, again referenced by Senator Feltus. And due to the ever increasing cost of insulin year over year, many diabetics go without this life-saving drug. And per the ADA, the American Diabetes Association, people with well-managed diabetes have a lower risk of complications if they contract the virus. So again, I think as referenced by Senator Feltus, House Bill 1280 couldn't be timelier. And I just want to thank you again for all the hard work that the Senate did on this bill in order to get it this far. And we've got a little bit further to go, but I'm sure we're going to get there. Thank you. And now I will turn it over to Madam President, Senator Soucy.
Thank you. Thank you so much. And Doug, are we going to be able to hear from you today? No? Okay. Doug's on silent, but we're so glad to see you. We're so glad to see your smiling face, and we thank you and all of your members for your advocacy on this important legislation. I have the bill before me right here, and I will sign it as we watch. Okay, I have signed Senate Bill 1280, and we will be sending it to the governor's office momentarily. And I hope all of you will join with me in encouraging the governor to sign this important piece of legislation. This really, really will have extraordinary benefits for people here in our state, and particularly during this time. So I want to thank you all for joining. It was great to see all of you, and I hope that we will be able to celebrate the signing of this legislation within the next 5 days. So thanks again.
Congratulations. Thank you.
Great seeing everyone.